Good afternoon. I'm George Latimer, Westchester County Executive. This is Wednesday, April 22nd, and we have our 2 o'clock coronavirus update for status of things here in Westchester County. Not a lot of new news to share with you. We do have some statistics that relate to today's numbers. We'll report that as of today, there are 25,276 Westchester residents that have tested positive for coronavirus. That number is an increase of 600 individuals over yesterday. So 25,276 is today's total number of people who have coronavirus. However, because of the number of people that have now been 2 weeks or more who had tested positive, but have not shown signs of the coronavirus in the 2-week incubation period, the number of active cases continues to drop. And today's active case number is 9,389 individuals. We went under the 10,000 mark yesterday. We've dropped another 500 cases from Tuesday. And that's a dramatic situation. When we look back 2 weeks ago, we were at 11,200 cases. So there is definitely progress being made to date, almost 2,000 less active cases today than 2 weeks ago. But the numbers are still high, and there's still the potential for there to be any surge in actives as we continue to do our testing. We've tested 76,564 people. At this point, that continues to be the highest per capita in New York State, and an absolute number second behind New York City in testing. You hear much nationally about how important it is to test, and of course, Westchester can feel confident that the efforts that have been made to test in our county have been robust, but still not enough in order for us to understand the full extent of the spread. We have unfortunately 838 deaths of Westchester County residents. That number is 29 higher than it was yesterday. The number of deaths overnight was a little bit less than we've had at other nights, but we don't know, excuse me, we don't know if we have a trend at hand because we haven't seen multiple nights at that relative number. But at 838 deaths, a significant number of people that are dying, particularly affected by the COVID the situation. If you look back 2 weeks ago, most of the indicators are very good. Our hospitalization rate, we're now hospitalized at just over 1,000 people, which is less than we were 2 weeks ago. Again, as I've just mentioned, our active cases are down 2,000 cases from 2 weeks ago, even though the total number of positives are up. However, the number of deaths have increased dramatically, where we have 838 cases of people who passed away today. 2 weeks ago today, we had 315. So that's over 500 people who have died over the last 2 weeks. That is a significant number. That's just a one county number. But even with that number, we're seeing significant numbers elsewhere. 926 deaths in Suffolk County, 1,431 deaths in Nassau County to date. And of course, nationwide, I think we have broken the 40,000 mark in number of people dying. And that is a statistic that nobody wants to point to with any kind of a positive reality. We're hoping that the expansion of testing, which has been much discussed, is going to be the reality of it. Here in Westchester County, we've had now for quite a while the Glen Island drive-through test location, and make sure that we have as many people tested from that as possible. There are going to be some changes in the Glen Island Bridge opening and closing now that we're in a season where there will be boats that will pass under the Glen Island Bridge. If you know the logistics down there, Glen Island is actually an island just offshore the mainland, easily reached by the small bridge. But that bridge will open at times and close, and the opening and closing will cause some problems for traffic down there. We'll try to be more specific about what those changes are tomorrow, so that if you are a patient that is going for a test at Glen Island, that you'll be aware of the opening and the closing of the bridge and what that will mean for you in terms of traffic at that location. We continue to have a number of other sites. We mentioned that last week and over the weekend, Mount Vernon Neighborhood Health Center opened up in Mount Vernon and St. John's Riverside. Park Care Center in Yonkers opened up, and there are discussions about other walk-in sites around the county in a variety of different places. As those testing sites expand, so will the number of people tested. We will probably see an expansion in the number of cases. But again, if we go through 2 weeks of the incubation period, people don't become sick from COVID, we may have a lot of cases, but then we'll also reduce the number of active cases. But nonetheless, this is a highly contagious disease. It spreads like wildfire, and we see that from some of the statistics community by community. Our numbers today show that Yonkers reports 4,200 cases, actually 4,194. New Rochelle, 1,861, Mount Vernon, 1,779, Greenberg Town, including the villages, 1,379, and the city of White Plains, 1,085. Those jurisdictions have all broken 1,000 cases each. And then we have the village of Portchester at 725 cases and the village of Ossining at 677 cases that are both significant number of cases. And we're also seeing a rise overall in the town of Mount Pleasant. When you add Mount Pleasant, Sleepy Hollow, and Pleasantville together as a group, you're also approaching the 700 case mark. On the downside, Pound Ridge still reports 16 cases, which is the lowest of any jurisdiction in Westchester County. Population base, as I've said every time I mention these things, the bigger the population, the more cases there are, the more densely populated the community, the more cases they are. So it's no surprising that our urban centers are getting the greater number of cases. But there's no question also now that we can state affirmatively that the curve has been flattened in Westchester at this stage of the game. Something can spike, maybe change it, but at this stage of the game, we have flattened the curve in Westchester County, and we continue to have a successful proportion of number of available beds, 3,000 beds, number of people hospitalized for COVID, 1,000 people in that vicinity, and that is a very helpful ratio. It continues to be a good number. As the total hospitalizations go down, that makes it even more likely that we'll be able to avoid the overflow situation. The county center, which has been turned into overflow beds, just completed their work 2 days ago. And so they have completed their work. They're having an inspection today by one of the senior officials with U.S. Army Corps of Engineers who report to them, will be in to survey it and I guess put the finishing touches on it. We may have a visit from the governor or from other high-level state officials to look at the site and to sign off on it. And it will be used for overflow from the various hospitals. And it could very well be used for patients that are not from Westchester, but as long as a person needs that hospital bed, we'll try to provide it to them wherever they're from. Doesn't have to be from New York, as long as that it's an opportunity for them to be safe and hopefully recuperate from this disease. As we lose people every day, we continue to have our flags fly at half staff out of respect for the lives of the people that we've lost. And we're going to make an effort to honor those lives at the appropriate time. We can't do it where we can't congregate right now because of social distancing and maximum number of crowds. But Westchester will not forget the people that we've lost, and we're going to maintain a presence at all times with that regarding. A few issues I've already touched on already, besides the ones that I've mentioned so far. Our economic development team is now back up and working on getting their volunteers to help individual businesses apply for SBA loans, the payroll protection program. Those programs apparently have been refunded, additional funding going into them by federal action. And because of that, where they quote unquote ran out of money last week, we stopped what we were doing to try to be helpful. We're now restarting that engine. And so working through assistance with Volunteer New York, those small businesses will be able to get some assistance in filing applications, and we'll be at the ready to help them. We are working through our local chambers of commerces to try to reach out to businesses. But if you're watching this and you're a small business and you say, my God, I'd like to apply for this, how do I go about doing it? Contact us. You can go on our website, westchestergov.com, look for our economic development indicators. We'll get to Bridget Gibbons. She'll assign someone to give you the walkthrough that you need to help you apply for the right kind of applications for Washington support. We mentioned yesterday that we have authority from the state. Governor of the state of New York has given us an executive order to apply a plan to help taxpayers who are financially stressed because of COVID virus. We briefed the Board of Legislators yesterday on the plan. We intend to discuss it in some greater detail today with our municipal officials. The plan is not proposed. The plan is in place. It's been authorized by the governor. It applies to towns and cities. And what it does do is it allows those eligible taxpayers to defer their tax payment from April 30th to July 15th. To be an eligible taxpayer as an individual, you must be eligible and enrolled in the STAR program. And that is a program that applies to people who live in their home and they apply for that benefit for their home. They must have an income of a certain level or less. And they certify that at some regular basis, so it is verifiable information. That information is available, easily available, in every tax office in our towns and cities, so this is not a hard threshold to reach. The second threshold is you cannot have your taxes paid by an escrow account, either through a bank mortgage, a mortgage company, or some other entity, you would not be eligible for the deferral of your tax payment if you have an escrow account that pays your taxes. And then you will have to sign a single-page document that has a couple of different categories, and you'll have to assert that you have been impacted economically by the coronavirus 19 impact. And when you sign that, that is a legal document under threat of perjury. So individuals who are signing for this are asserting that they have had an impact, they are STAR eligible, no escrow, and that will make them eligible for deferring their tax payment until July 15th. There's a similar standard for businesses under $1 million in revenue, and there's also one for small property owners. We're going to brief in general terms the municipal officials on that later today, and we'll talk about how to implement it. It is an optional program that a town or city can enter into, and if they do, they then become eligible for a reduction in the payment that they have to make to Westchester County on behalf of property taxes collected. So we hope that that creates some financial benefit for those towns. I might add, though, that every town and city will receive a payment in early May that represents their first quarter of sales tax receipts that covers the period of time of December, January, and February. That's the period that includes the holiday shopping season. COVID-19 had not yet impacted our businesses in the month of February, as it subsequently did in March. So the money that the county will be sending to the towns and cities on behalf of sales tax will be a fairly robust amount of money. That is not enough to get us through the budget year. All governments are in deep financial trouble in the long run, but in the short run, the concerns about cash flow should be made positive by that influx of sales tax money, and that will be a helpful sign. But we are willing to negotiate with towns and cities for a lower amount than 60%, and that was authorized as well by the state government. The plan that the County Board of Legislators has passed, which remains in on my desk for action, involves an across-the-board reduction of late fees, not an elimination, but it does reduce them over the course of the period from April 30th to July 15th. That program may be available to those who do not qualify for the full benefit because they either have income that makes them higher than STAR eligible, or because maybe they are involved in something in which the assertion of impact, financial impact, is not easily made, but they still want to point out that they're impacted at some level. So we're going to try to put these two programs together, have it available to be announced publicly within a few days if we can do that. And then you can certainly say that your county government, your city government, your town government work together with the support of the state government. This would not be possible without Governor Cuomo's help. And we have reacted favorably to the pressure under our property taxpayers. And we have done this ultimately, cooperatively and collegially, bipartisanly. And while there's always a bump in the road when we discuss these things, the end result is what matters. And if the end result gives taxpayers a break, then we will have done our job. Beyond that, most of the other things to report, we've already reported on. I'm not of the mind to keep you hanging in suspense on every different moment. I will mention today is Earth Day. We had an earlier conversation with the executive director of T-Town, a very helpful conversation. If you want to go online, you'll see it. Kevin and I had a nice conversation talking about what Earth Day is. We also had a conference that lasted this morning that Peter McCart from our team and a number of other people put together that involved a number of speakers and breakout sessions as far as Earth Day is concerned. We care deeply about this pandemic that we're dealing with, and we care deeply about the financial impacts of the pandemic. Those are issues 1 and 2, health and wealth, that faces us. But those are not the only issues we face. The environmental protection is an important issue. Census 2020 is an important issue. We remind you, if you haven't filed a census form, you probably have a paper form in front of you now. If you haven't filed already, you can file the paper form. You can still go online, my2020census.gov, fill out the census form. We have now until October 30th to reach everybody, and we want to reach everybody in this county. If you live here, you should be identified as living here, and you should be counted as part of the Census 2020 form. So with that, that's the end of our update. I'll turn to Catherine Chaffee, our Director of Communications, to see if she has any questions from our friends in the press.
We do. We have a couple of questions. So the first question comes from News 12. It's relating to the county center. You've answered some of it already, but they ask, the Javits Center is fairly empty. Are you concerned the county center will not be needed?
Well, if the county center ultimately is not needed, then I would consider that a positive situation. Remember what the ultimate mission here. The ultimate mission is to save lives. And what we all saw in China and what we saw in Italy, and then what we saw in Spain was an overrun of the existing healthcare system. If you look at northern Italy, which is the wealthier part of the country, cities like Milan, which are seen as modern, up-to-date cities, were overrun with the number of patients. So we had a little advance notice. And what do we do with the advance notice? The royal we, it was the state and the U.S. Army Corps of Engineers. We built some backup hospital rooms in a number of different places, Javits Center in the city and here at the county center. We were not going to have events at the county center anyway because of the social distancing and the prohibition of groups of 500 or more. So with that, and those resources were spent to do that building by the U.S. Army Corps of Engineers, not specifically by the taxpayers of Westchester County alone. And the additional hospital rooms were built as a backup to avoid the worst case scenario. If the worst case scenario comes, that does not mean Monday morning quarterbacking. We did something that was foolish. What we did was prepare for the worst. And if the best comes to pass, then we'll consider ourselves fortunate. But I don't consider the effort that was made by the state and the federal government at the county center to be a foolish idea. It was a wise idea in protection. Now, because we're talking about Westchester numbers and maybe New York City numbers, we don't know yet what we're facing. I hear reports out of the city all the time about how many hospitals are filled to the maximum and overflowing in the city. So I'm not sure how the individuals are moved around who are in need. And I also don't know how many people currently have been deferred from going to a hospital for care because there's no room at their local hospital to handle them. All I know is that the county center facility, now that it's been built, is there if it's needed. If at some point in time we know it's not going to be needed, it'll be deconstructed and it'll be returned to its original use. That's the promise we have. But I have to assume that the decision makers in the state health department erred on the side of caution. If the opposite had happened, if we had done nothing, if we had bet that we would have a comfortable situation and we guessed wrong, then we'd have people on cots in gymnasiums and unable to get the proper health care, not enough of the equipment needed. And then we would have had a multiple loss of life, and we would have been to blame for not preparing for the worst case scenario. So I'd rather be criticized generically for preparing for the worst and it not happening than assuming that it wasn't going to happen and having the worst happen. I think all of us as adults, prudent adults, make those kinds of decisions. And that's how I view the use of the county center. It is there. The county turned it over to the state and to the feds to do with it as they could. We hope if it's needed, it's used. If it's not needed, that they'll reconfigure it and turn it back over to us. Either way, we're trying to do what's best for the greatest number of people.
Okay, the next question comes from the Journal News from Mark Lingariello. Yonkers Mayor Mike Spano announced that there are 100 city employees out due to coronavirus. Do you have any tally of how many Westchester government employees are out sick or quarantined as a precaution related to COVID-19?
I don't have that number. I think I did promise a couple of days ago we try to find out. And if we've neglected to do that, we will do that. We have projected to the greatest extent possible for as much of our staff to remain sheltered at home rather than come into their normal work facility. We have certain facilities that must operate with people present, our sewer treatment plants, our county jail. There's some other facilities for which it is necessary for us to be present to do the job necessary. Our county police, our county health department are out doing yeoman's work. Our emergency services department is all hands on deck. Some of our other departments, if you walk through the county office building, our law department, budget, IT, finance, planning, those departments, many people can effectively work from home. And if they have had symptoms of COVID or if they've tested positive for COVID, they've been home. And unless they're seriously sick, then they're still able to do work from home. They're able to go on their laptop and communicate and perform functions that are appropriate of budget, finance, planning, law, things of that nature. So we'll get a number for you. But I think the real concern for any municipal government in terms of number of employees out is really what number of employees that provide essential services that deal with public safety are out. The police department numbers are critical in that regard. Emergency services numbers are critical in that regard. We do not have a fire presence. We have a fire training center, but we don't have firefighters for the county that actually fight fires. In a municipal government, and certainly the size of the one that Yonkers has, Yonkers police force is larger than the Westchester County police force. In those particular areas, that's where whatever absences we have are most critical. We'll get some numbers and share them with you. At this stage of the game, we've seen no crisis erupt where we were unable to do a particular function in the county government. And now we've been dealing with COVID now, positive cases for 7 weeks. Obviously, a problem can turn up at any point in time, could turn up in the next hour. But so far, we seem to be managing our governmental responsibilities within the workforce we have available to us.
Okay, last question also comes from Mark Lingriello. He asks, there have been reports that ventilators may actually be dangerous for COVID-19 patients. Does the county follow how many people who have died were on ventilators?
We don't have those statistics. I think we've identified this. Whenever we've talked about statistics, all the statistics that we deal with come from the State Department of Health. We'll ask about that information to try to see if there is an answer for it. I think probably directing that question to the state executive branch is probably the way to get the quickest information. But I wouldn't know specifically if the ventilators somehow contribute to the COVID deaths or not. Obviously, I'm not a person of medicine or science. We follow what advice we get from professionals. They have indicated to us over the course of this whole contagion that ventilators were important as a method to keep people alive. I know that Lawrence Garbus, the index patient, would not be alive today if a ventilator didn't help him keep breathing during the worst part of his health situation. And I've heard other anecdotes about some who have rebounded from a severe COVID attack and needed ventilators. But it may be possible that, the report that's alluded to is the case. Very hard for us in local government to track it down. We'll ask the question of our state colleagues and see if they have some information for us.
That was the
Any other
last
questions, Catherine?
That was the last one.
Okay. Well, to any of our friends in the press who are tuned in, if you do have any questions for us offline, please reach out to Catherine or myself. We'll be happy to try to answer them. We will be discussing with our municipal officials our tax program a little later this afternoon. And hopefully, as we go forward, we'll continue to see a diminution in the number of people hospitalized and a diminution in the number of active cases. We recognize now, as we approach the last week of April, that we are in this for the long haul. This was not a 2-week shutdown and reopen. We are going to be reopening a couple of golf courses this weekend for those that can play. And we'll see how we go further with those issues. But again, we're trying to make the most intelligent decisions we can based on the scientific information we get, based on best practices elsewhere. And with some luck, hopefully we'll get through all of this and we'll be able to have a conversation about what we learned from this on the other side. But we're still in the middle of it, so we press forward. I'm George Latimer, County Executive. Thanks for tuning in. And our next time will be again tomorrow morning at 11 o'clock, where we'll have another Facebook Live interview, hopefully of interest. And then we'll be here again tomorrow at 2 o'clock to give you the update at that point in time. Have a good day and stay safe.